Focusing the presidential debate issue is a program that was organized by John Norton Moore, who's a professor of law at the University of Virginia, and he has a long-standing history in government policy and has been an advisor to many presidents with respect to both national and international law. The goal of the conference is to bring together a group of experts across a very broad spectrum of issues that affect the American population, including foreign policy, immigration, criminal justice, and the area that I'm going to be discussing, which is targeting diseases. The goal of the conference is to present this information in a concise fashion and to provide this information to the presidential candidates with the goal of integrating into the debates really important issues that need to be addressed by our government. I've been asked to talk about targeting diseases, and there, of course, is a very broad spectrum of illnesses on which I could focus. And I have made the decision to focus on musculoskeletal diseases for several reasons. Probably the most important reason is that if we look across the spectrum of illnesses and diseases that result in disability, loss of function, loss of work, and we ask ourselves, what are the conditions that are the most common cause of disability? They are the musculoskeletal diseases. They are the diseases that affect the bones, the joints, the ligaments, and the tendons. And whereas conditions such as cancer and cardiovascular disease certainly capture the attention of the public and of the individuals involved in the presidential debate, what they're not recognizing and focusing on are those conditions that are actually costing our society and our government the most money and producing the most loss of work and disability in our population. And much of the discussion in the arena of health and medicine has focused around access to health care during this last period of time. But this past decade has witnessed a revolution in the technologies of medical research. And it's become clear that one of the most effective ways to address the healthcare needs and to provide care for individuals suffering from chronic and acute illnesses is to develop more effective therapies. Therapies that control the diseases better, therapies that are much less costly. And so the focus, we hope, will turn not necessarily away from access to healthcare, but putting attention on research, which ultimately really will be the only way that we can find and understand better disease mechanisms, identify targets for therapy, and then translate these discoveries into new treatments which would hold the promise of substantially reducing healthcare costs and needs by providing more effective therapies for patients.